Okay, so in this video, I just want to talk about how COVID-19 vaccine efficacy is calculated. Now, you keep hearing that the Pfizer has an efficacy of 95%, and Moderna has an efficacy of 94.1%, etc., etc. So how do they exactly calculate this vaccine efficacy? So I'm going to use a simple example to explain how vaccine efficacy is calculated. Now, in any kind of trial, there are two groups. One is going to be called, this is going to be the vaccine group, okay? And the other one is called the placebo group, okay? So we have the vaccine group and then we have the placebo group. Let's say that there were 100 people in the vaccine group, which means that 100 people got the COVID-19 vaccine. And let's say there were 100 people in the placebo group, which means that these 100 people did not get the COVID-19 vaccine and they got a placebo, which really means that maybe they just got salt water. Okay. Again, please remember that it's a double-blind controlled study, which means that the person getting it doesn't know that if they're getting a vaccine or a placebo, which is salt water, or even the people giving it, they don't know if they're giving the vaccine or the placebo. Okay, so this is called a double-blind controlled study. Now, okay, so 100 people got the vaccine and the other 100 people got placebo. Okay, now it's done. Okay, now you follow up. Now let's say out of the 100 in the vaccine group, 5 of them had symptoms, and when they were tested, they tested positive for COVID-19. Okay, and in the placebo group, let's say 20 people came back and they were tested positive for COVID-19. Now, what you can do is you can calculate the percentage. Okay, so how do you do that? Okay, so what you do is you calculate not really a percentage, but you can calculate the fraction. Okay, so what you do is in the vaccine group, 5 of them got infected. Okay, out of 100. Okay, which will give you, so 5 by 100 is the fraction. Now I'm going to convert this to a decimal, which is going to be 0.05. Okay, and in the placebo group, 20 people got infected out of 100, which is going to be 0.2. So this is called as risk. Okay, so that's the infection risk. Okay, and this is the infection risk in the placebo group. So out of 105 people, so 5 divided by 100 is 0.05 for the vaccine group, and for the placebo it's 20 divided by 100, which gives you 0.2. Now what they do is they subtract the two. Okay, so what they do is the risk for the placebo group minus the risk for the vaccine group, you subtract the two and you get 0.15. Okay, so that's the difference. Now the final step is that difference divided by, remember, the fraction and the decimal, 20 divided by 100, the decimal was 0.2. That's the risk for a risk of infection for the placebo. So the difference divided by the risk for the placebo, they're divided. So you have the difference as the numerator. So this is going to be the difference. And this one is the risk for the placebo. Now, this will give you 0.6 0.75, and which means that this vaccine is 75%, has an efficacy of 75%. Okay, so this is how efficacy is calculated. Okay, so again, so it's sometimes difficult to find this information. Okay, so it's often confusing. So I think hopefully this will help you understand how the efficacy percentage is calculated. Thank you for listening.